How to read an APGAR score. The APGAR test is one that measures the well-being of a baby shortly after birth. Virginia APGAR developed the test in 1952, and since then, it has become a standard test for most newborns. Basically, it just gives the medical staff a numerical way of assessing the health of the baby. Part 1. Reading the categories. 1. Learn an acronym to help. Even though APGAR refers to the designer's name, it can also be used as an acronym. APGAR can stand for appearance, skin color, pulse, grimace response, reflexes, activity, muscle tone, and respiratory. This test is used to measure the overall well-being of the baby by looking at the major indicators of wellness. 2. Look at the scores for heart rate. The first category on the APGAR test is heart rate. A nurse, doctor, or midwife will check for the baby's heartbeat. The medical staff will also determine the pulse rate to see how the baby is thriving. If the baby doesn't have a heart rate, the score is 0. A score of 1 indicates a heart rate under 100 beats per minute, which is not quite as fast as it should be. A score of 2 indicates the baby's heart rate is over 100, which means the baby is thriving. 3. Learn the rating for breathing. The next category on the APGAR test is breathing. A person on the medical staff examines the baby to see how they're breathing, then assigns a number to the breathing effort from 0 to 2 based on what they observe. A 0 means the baby is not breathing, while a 1 means the baby has irregular breathing. A 2 means the baby is breathing just fine, which usually means the baby is crying. 4. Watch your baby's movement to determine muscle tone. After breathing comes a check of muscle tone. Muscle tone just measures the baby's activity to see if it is moving around on its own. An active baby indicates that they are doing well. A 0 indicates the baby is limp or not moving much at all. If the baby is given a 1, it means they are bending arms and legs and moving some, but not as vigorously as the doctor would prefer. A 2 means the baby is actively moving around. 5. Understand the score for the grimace response. The grimace response is how the baby reacts to mild stimulus. For instance, the baby may be lightly pinched to see if the baby responds a lot or if it doesn't respond at all to the stimulus. A 0 indicates no response. A 1 means the baby pulls a face, grimaces, but doesn't sneeze or cough. A 2 means the baby pulls a face and sneezes or coughs in response. 6. Look at the appearance score. The final category is appearance. In this part of the test, the medical staff will look at the baby's skin color. The skin color can indicate whether the baby is receiving enough oxygen or not. A 0 in this category means the baby is blue all over. A 1 means the baby is mostly a healthy color but may be bluish at the hands and feet. A 2 means the baby is a healthy color all over, including pink at the hands and feet. Part 2. Reading the test as a whole. 1. Analyze the whole score. The score from the APGAR is generally taken as a whole rather than in individual categories. In other words, all the scores from each category are added together to get one number. The best possible score is 10, which means the baby is doing as well as they can be. However, most babies don't score a 10 at birth. A score from 7 to 10 means the baby will just need standard care. If the score is under 7, the baby will need more monitoring and possibly interventions, such as help breathing. 2. Don't be afraid of low scores. While a low score may seem scary, it usually doesn't mean the baby will have long-term health effect. Rather, it just means the baby needs a little extra care right after birth to help stabilize their health. certain factors can cause the APGAR score to be lower. Often, it's caused by a C-section or a birth that's a bit more difficult than other births. A low score can also be caused by fluid in the airway. 3. Prepare for interventions from the medical team. If the baby has a low score, generally one of two things will happen. With the first intervention, the baby's airway will be cleared out if it has fluid, and the baby will be given oxygen. A second option is the baby may be given stimulation to get the heart beating more rapidly. Part 3. Learning about the timing and positioning of the test. 1. Be aware where the test will be performed. Generally, the baby will be placed somewhere warm while the test is performed. That can either be on a parent's belly or under a warmer. Keeping the baby warm is important. 2. Understand the 1-minute test. As the name implies, the 1-minute test is performed a minute after the baby leaves the mother's body. It tells the medical staff how well the baby did during the birthing process and accesses the baby's need for assistance. 3. Learn about the 5-minute test. The 5-minute test, as it sounds, is given 5 minutes after birth. This test is the same as the 1-minute test, but it's given to measure how the baby is doing out in the world, out of the womb. This test also helps evaluate whether any interventions are working. 4. Watch for it to be given a third time. While the test is usually just performed twice, it may be given a third time. Usually, it's given a third time if the baby has a low score, to see if the baby has improved any from the 5-minute test.